Well, I mean, I think what we all knew was that there was an extremely wide range of possible outcomes, and that we didn't have, at that point, the diagnostic capacity to be able to track this. So we knew we were, to some extent, flying blind, and that was clear at the time, and it's been clear since. So inevitably, uh, we were very concerned that the top of the range outcomes were even worse than the very bad epidemic we've had in the UK. And there was that range existed from the beginning and was clear from the beginning. We tried to communicate that from the beginning. So we were clearly extremely concerned. As you say, we are not by any means out of the woods yet on this. In much better shape due to the vaccine program and drugs and a variety of other things. But this has got a long way to run in the UK, and it's got even further to run globally. And I think we really shouldn't believe that this is somehow just about to finish. That is far from where we are at the moment. I've been very confident right from the beginning that science would find us a way out. What wasn't clear early on was which area of science. So the last pandemic on this scale, for example, HIV, we looked for a vaccine, we still don't have one, but we do have excellent drugs, and behavior has changed, and that has led to a complete change of the disease. With this one, yes, we're substantially much lower risk now due to vaccination and some drugs. I'm confident in a year's time we'll have better vaccines and more drugs. That will help take the risk even further down. And at a certain point, we'll be able to say virtually anything it can do to us, we're likely to be able to respond to quite quickly. But in the medium term, we could get a vaccine escape variant that actually gets around our principal line of defense, which is vaccination, at least to some degree, and takes us some of the way backwards. The further out in time we go, the more tools we have at our disposal from science, the less likely that is, but you can never take that possibility completely off the table. But science has done a phenomenal job so far, and it will continue to do so. Yeah, I mean, I think that one of the things that I've said really as clearly as I can for the next stage is questions about regulations are essentially binary. People's behaviour is not binary, and what we really need to do, all of us, is take things incredibly slowly. I would reiterate that now, that every stage we take has got to be taken very slowly, and this next stage in particular, we have to at some point get to a point where there aren't regulations that are specific to COVID. We need to get to that point as slowly as we can, and that's around people's behaviours. And if you look over what people have done, and in fact, if you look at what people intend to do now, people have been incredibly good at saying, I may be at relatively low risk, but people around me are at high risk, and I'm going to modify my behaviours. I'm going to reduce my contacts. I'm going to wear masks in crowded environments. I'm going to open the windows and improve ventilation, meet outside. The things we know work. And they've done that, and they intend to continue to do that. And that's the key to this. We've just got to go slowly. One of the problems that have always faced in trying to communicate this is that the way that epidemics work is they just go by exponential curves, and that's incredibly non-intuitive. People don't find that easy to understand, but they're either doubling or they're halving. And currently this epidemic is doubling, and it's doubling in cases. It is also doubling in cases people going to hospital, and it's doubling in deaths. Now, at the moment, the number of cases in hospital is mercifully much lower than it was previously, but not trivial. We've still got over 2,000 people in hospital, and that number is increasing. If we double from 2,000 to 4,000, and 4,000 to 8,000, to 8,000, and so on, it doesn't take many doubling times till you're into very, very large numbers indeed. And the doubling time at the moment is probably around about 3 weeks. Could be a bit less than that, actually, for hospitalizations. So it doesn't take many doublings till we're in actually quite scary numbers again. And of course, for every individual person in hospital, this is potentially very dangerous, and there will be people who die or have lifelong effects from this. So I don't think we should underestimate the fact that we could get into trouble again surprisingly fast. And I think saying the numbers in hospital are low now, that does not mean the numbers will be low in hospital in 5, 6, 7, 8 weeks' time. They could actually be really quite serious. And as Kevin says, at that point, if it looks as if things are not topping out, we do have to look again and see where we think things are going. So it is very important that people don't imagine just because numbers are low now, they will always stay low. Exponential curves look as if they're going very slowly, and then suddenly they look as if they're going very fast, and that's just the maths of them.